In this video, we are going to be talking about how to optimize brain health. Now, the reason we say optimize and not treat or fix is because we do this non-invasively and without the use of drugs. Also, we're not assuming that the brain is broken or needs to be repaired by some outside force. Rather, we are wanting to give the brain a way to optimize itself. Everyone always asks, what does an optimized brain feel like? And I guess what I would say is the first thing that people usually notice is a substantial improvement in the quality of their sleep. Our patients almost always start out by saying that they notice that they're sleeping more soundly, feeling more well-rested when they wake up. And then after seeing us for a few sessions, people next talk about feeling more calm, more focused. They start working faster, more efficiently, start to have fewer physical complaints as well. Things that used to seem stressful no longer are as much. Anxious thoughts begin to slowly fade away. Also for the kids, we found that kids begin to calm down and focus quite a bit better. The autistic kids that we've had in particular begin to rapidly learn how to read and interact socially with their peers. At our clinic, we've noticed that when the brain is balanced, very transformative things can begin to take place in someone's life. Things that were previously difficult now come naturally. Brain activity is measured in microvolts on the left axis over here. The yellow line that you see represents the amount of activity in the person's left hemisphere of the brain, while the red line represents the amount of activity in the right hemisphere. Finally, the purple line that you see here is a measure of coherence, or level of synchronicity, between the two hemispheres. So, speaking broadly, there are three basic components for a healthy brain. First of all, we want to see the two hemispheres of the brain in good balance with each other. That means we want to see those red and yellow lines perfectly on top of each other. Another aspect that we want to consider is something else called harmony. Harmony is what you might think of as the level of synchronization or proportionation of activity between the different lobes of the brain. Finally, there is one more component called coherence, which is related to how well the two brain hemispheres are in sync with one another. These systems work by taking the recorded brain frequencies and converting those frequencies into sound, in much the same way that your car's radio will transform radio waves into sound, turn those into sound waves, and then play them back for a person to listen to. The assessment involves placing two electrodes on the ears, two sensors on each side of the head, and also a grounding sensor is placed in the middle on the top of the head. For the first few minutes of a session, the brain may not change very much at all. It's just listening to these sounds much like it would listen to any other sounds. But after a few minutes, we start to see remarkable things take place. Where there are differentials between the two hemispheres, these begin to come into balance. The hemisphere that is too high will begin to lower, and often the hemisphere that is too low will rise slightly, so that by the end of a 20-minute protocol, those red and yellow lines are much closer to being in balance. When it comes to amplitudes in the brain that are too low, these amplitudes will begin to rise to healthier levels. Similarly, for amplitudes that are too high, we begin to see those amplitudes calm down. In many cases, we will have a combination of problems, even in a single lobe of the brain. As an example, here is a depiction of a graph for an individual who has balance problems, harmony problems, and coherence problems, all in his temporal lobes. On the first day's session, according to the red line here on this graph, his right hemisphere started at nearly 30 microvolts, but finished at closer to 15. Also, you can see that the coherence, or purple line, is very low, but has increased slightly. The coherence in the temporal lobes at this low frequency should be at a bare minimum of 25%, but ideally closer to 40%. Now, it would be nice if by the next session the person was able to come back right where they left off, but usually the brain likes to go back to the way it was before. So when we start the next protocol on the second day, the right hemisphere may start out closer to 25 microvolts. Not as good as when we finished up on the first day, but still better than where we started originally. By the end of the second session, it looks like the right hemisphere finished right at 15 microvolts, with the left hemisphere at 10. This is still a large imbalance, and the overall amplitude still needs to come down further to approximately 5 microvolts. Over the course of doing sessions, we are able to see very clearly the brain's progress. As we go into time-lapse speed here, you can see that with each session that we run, the brain gets closer and closer to being in balance. The overall amplitude of those red and yellow lines is also starting to come down. And very importantly, for sleep function, the level of coherence is starting to rise. By the end of only 10 sessions, we have gotten this lobe of the brain looking perfect. How likely is it that I will really notice a difference after my sessions? This is really a fair question because so many forms of alternative medicine are not objective. And in quite a comparison, these mirroring technologies that we use, brainwave optimization and neurooptimal, are very objective. We're able to see exactly where someone started out and where they finished after the sessions were complete. In fact, we print out a book for each and every one of our patients with before and after graphs showing how the brain has changed through the process. The brain really has an amazing ability naturally to change. This is called neuroplasticity, and it's something that is continuing to surprise and astound the medical community. In fact, it continues to astound us here at our own center, even though we see it every day. We have seen many patients with different conditions and concerns. Maybe you have a child that is struggling in school or at home. Bring the whole family in. Make it a special occasion. Maybe you're concerned about taking medications long term and would like to gradually get off of those medications. Maybe you're not taking medications at all, but you have a chronic or complex disorder that you know is affecting your nervous system. Maybe you've had some recent physical or emotional stressors in your life. Or maybe you're just lacking the energy and drive that you used to have. Give us a call and we'll take the time to talk about it. All right, so we're here now at the retreat on Cozumel Island. We call this Exodus Wellness Center. You can see one of the cabins right here where the clients can stay. And then we'll just walk a little bit and I'll show you another one of the cabins. You can see one of the other cabins right here where clients can stay in. And in just a moment, we'll walk down the jungle trail and see Manuel, one of the therapists, working with one of the clients. All right, well, we're here now on one of the nature trails here at the retreat, and you can just come a little bit this way. And if you turn left, you can see Manuel working with one of the clients. Manuel is working the muscles. It also works the lymphatic system for the clients. And if you want to come just a little bit around here with the camera, you can get a closer view on how this works. Santiago, how does it feel?
Nice.
Good, good.
Stretching.
You can feel it stretching?
Yes.
Good, good. Okay, so we're here on one of the nature trails now here at the retreat. And if you want to come just a little bit over here, I'll introduce you to Manuel, and he is one of our therapists here at the clinic, and he's working with a client here. And you can see how this works a little bit. Manuel, if you want to just, yeah, there we go. Now you can see a little bit what Manuel is doing, massaging the muscles and the lymphatic system. It's very important to get the lymphatic system moving in terms of the detoxification that we do at the retreat. Okay, let's do one more take. Okay, we're here on one of the nature trails here at the retreat. And if you want to come over just a little bit, I'll introduce you to Manuel. He is one of our therapists, and he works with the clients on massage and exercise therapy. You can see what he's doing here. It's very important in our program to get the lymphatic system moving, as well as stretching the muscles. And when we do that, we are helping facilitate the detoxification that is important when it comes to the program. So, how does it feel?
Stretching, I feel.
You feel it stretching? Okay, good. Manuel is doing buffeting. That's an important part of the process. Okay, I think we got it.